do know also that African Americans are more prone to cancer at an earlier age. In addition to getting cancer at an earlier age, we know that African Americans, stage for stage, have a worse prognosis, underscoring the importance that doctors should talk to their patients and patients should talk to their doctors about their individual risks, about when is it appropriate for them to start screening. For the normal population without any significant risk factors, the U.S. Preventative Service Task Force recommends that we start screening at age 45 because we know the incidence of colorectal cancer is getting younger and younger with each generation.
And Doctor, I have a question here from one of our viewers. Her name is Donna, and this is what she writes. My insurance company sent me a home colon cancer test. Are they any good? Okay. I didn't even know that exists. So Donna, thank you very much. Are these reliable, doctor? And I guess I'm going to follow up with saying, can they take the place of a colonoscopy? I'm going to think no, but I'm going to let you take that one because you're the expert.
Well, actually, the U.S. Preventative Service Task Force, which is the national group that determines how we as Americans are going to screen our population, has recommended the FIT test, or the immunochemical test that you do at home, and you send the stool card back to the lab, as a reliable test. It has to be done every year, though, and it can only be done in patients who are considered average to low risk. Anybody who's a high-risk patient does not qualify for this test. Now, the downside of this test is it may say, yeah, you do have something suspicious. That must be followed up with a colonoscopy. Because the colonoscopy not only determines if there's anything suspicious, but has the possibility of removing that polyp or removing whatever is causing that abnormal test before it has a chance to turn into a cancer. On the other hand, we can do a colonoscopy right from the beginning. The colonoscopy, again, allows you to visualize the entire colon and remove those polyps before they ever have a chance of turning into a cancer. So for some patients who can't get colonoscopies, the FIT test or the stool test at home is a reliable alternative. However, the gold standard and the one that we all preach about is colonoscopy. So unless someone has a major contraindication to getting a colonoscopy, the FIT test is okay. But given our choice, we much prefer to recommend patients to get a full colonoscopy.
I'm sure the test at home is a lot easier than the one we have to go through to get a colonoscopy, right, doctor?
That is true. Now, I'll remind everyone that the colonoscopy is only bad for the day or two leading up to it when you take the medicine to help clean yourself out. The day of, you're golden, because all it is a little bit of propofol and you're asleep, and the next thing you remember, you're having lunch. So it's really just a couple of days, but it can save a lifelong of cancer in the future.
And I have to completely agree, because I was having some stomach issues, I want to say about 10 years ago, in my early 40s, yes. And I did a colonoscopy. It was not fun to go through that process. But you know what? They found 2 polyps. And thankfully, they were benign. But thankfully, I did it because, doctor, who knows, right? What if I wouldn't have done it? What could have been 10 years later?
Right, that's 2 cancers that could have potentially developed. So you, in essence, saved yourself from developing 2 cancers later on in the future. Now, we don't know that every single polyp turns into a cancer, but who wants to take that risk? I think every polyp should come out one way or another. And by removing the polyp, we remove that cancer risk. So unfortunately, like you mentioned, the prep is not fun. It's probably the hardest thing that most of us have to do for screening, but it really can save your life. And although it's bad, it's not that bad. It's something that we can all do. We all should do it once every 10 years.
Well, all I know is when I went to Publix the next day, I never wanted to see Jell-O anymore for a few weeks. And just to follow up, I had to do another colonoscopy. I think it was 6 years later, and they found 1 more polyp. So at the end of the day, I'm going to have to continue doing it, and it's well worth it. And I always tell everybody, get your colonoscopy.
That's right. Well, I always joke with patients that if you think the prep is bad, imagine how bad chemo is. So it's probably worth to take the prep.
Another viewer question. This one is from Vicky. So let's take it and see what she has to say. She writes, I'm in my 60s and have never had colon cancer, but I do have diverticulitis. I occasionally get blood in my stool when I'm stressed. I've had colonoscopies and they haven't found cancer, thank goodness. Am I at higher risk because of my condition? Doctor, your thoughts for Vicky? And thank you, Vicky, for sending that in.
Yeah, thanks, Vicki. This is a really common question, actually, because the two can kind of go together in terms of masquerading each other. So first off, diverticulosis are little pockets of the colon. Those are little growths of the colon that form little pockets that can then get infected and cause pain, inflammation, and even a localized infection. Now, that doesn't in itself lead to colon cancer in any way. It just, though, however, is a marker of a poor diet. So oftentimes people with diverticulosis have low fiber diets. And we know that patients with low fiber diets are also at risk for colon cancer. So whereas the diverticulosis in and of itself doesn't lead to colon cancer, the same behaviors, the same diet, the same lifestyle leads to both. So if anything, it's more of a wake-up call, saying, well, the diverticulosis itself is very different from colon cancer, but this may be a wake-up call to start changing my diet so that I don't develop a colon cancer in the future.
Fantastic. Thank you so much, Doctor. Another viewer question, and this one is from Caroline, and I actually love her question as well. I love all the questions. I think it's fantastic. My doctor wants me to have a colonoscopy test, but I'm in my late 70s, in good health, and have no history of colon cancer in my family. Is it necessary for me to have one? Oh my gosh, I love that question, and that's actually something my mother asked me the other day.
You know, that's such a timely question. We just talked about that this morning at our senior adult meeting. So yes,
really?
It is. What we really look for is, are you capable of withstanding the treatment if we were to find a colon cancer? So if we were looking at somebody who's 70, horrible heart health, horrible lung health, not going to survive a surgery, not going to survive the colonoscopy, definitely not going to survive chemotherapy, then the colonoscopy probably wouldn't be indicated in that patient. On the other hand, you have a patient who's 85, and that patient still plays golf every day, and that patient's healthier than I am. Well, heck yeah, that patient definitely needs to get their colonoscopy, because that patient not only will survive the treatment, survive the cancer, survive any eventual surgery, but flourish years afterwards. Then yes, that patient definitely should go on and get their colonoscopy. I had a personal record 2 weeks ago, and I operated on a 98-year-old, which is by far my oldest patient, but she's
goodness.
Great. Yeah, so she definitely got her colonoscopy at age 97. They found the colon cancer. A couple months later, I operated on her, and she sailed right through surgery. In 3 days, she was home and is back shopping now. So that's just a testament that it's not the age, it's the individual that we look for.
That's fantastic. And I'm glad you brought that up, because we only have about 4 minutes left, doctor. But, you know, if you do have colon cancer, what are the treatments today? You obviously said surgery. What is available for patients?
Right, so that a lot of that depends on the stage. So just like with all the cancers, we really care about the stage of the cancer. Colon cancer is staged based on 3 different factors. The first thing is the tumor size, or how deep the roots of the tumor grow into the wall of the colon. The second thing we care about is those critical lymph nodes that we were talking about earlier, and which are the hallmark of if the cancer is going to spread. And the last thing is any metastasis, or has it spread. Once we take out the tumor and we take out the lymph nodes from surgery, then we can say what the stage is. And knowing the stage, we can risk stratify patients and say, well, this patient would do better if we gave chemo, or this patient probably doesn't need chemo. So not everyone with colon cancer actually needs chemo. The majority of patients are just fine without it. So we would give chemo to those patients of more advanced stages. Obviously, once patients have disease beyond the colon that has started to involve the liver or the lungs, then those patients would get, chemo for a lot longer.
And doctor, is there anything on the horizon? I always like to end with hope and just hear the end of cancer, period. But anything on the horizon that patients can look forward to, treatments, things that are clinical trials, stuff that are promising?
Yeah, well, I think honestly, the biggest news that we could have ever had was this most recent guideline change by the Preventive Services Task Force. We've been clamoring for this. The American Cancer Society has been asking for this. Now that the national boards have started to decrease the screening rates, people are taking this more seriously. We know that we can catch cancer at a very early age or prevent it among our younger Americans. So this was a huge step forward in preventing colorectal cancer.